Hey folks, this is Dr. Jason Young from Body of Health Chiropractic and Wellness Center. And today I'm bringing you a video about one of the most commonly misdiagnosed conditions that I see in my practice. I have people who come in all the time talking about their headaches, saying, I get migraines, or they've been told by their doctor that they have migraine headaches. And just by listening to their history, doing an examination, it turns out that their headaches are not migraine headaches at all. And so it happens a lot, and I think it's annoying, so I'm making a video. So what I want to do in this video is I want to give you some information that by the end of this video will help you to, first of all, learn the difference between a migraine headache and just like a really, really bad headache. In addition, I want you to know why it's important to differentiate between a migraine headache and other types of headaches. And then finally, I'm going to give you some simple steps that you can take before you even see a doctor, even a chiropractor, about your headaches that could help them to resolve on their own. Now, who is this for? This is for anybody who has bad headaches, whether it's, and typically it's people who are having them a lot, right? Like you're getting a headache once a week, twice a week, a couple times a month, and it's bad enough that it is disrupting your lifestyle. And so you might have told people, yes, I get migraines, or I've got a migraine, or I can feel a migraine coming on. And you want to know the difference, because if you can identify the right kind of headache, then you can give it the proper treatment. So first of all, don't feel bad if you have misdiagnosed yourself with a migraine headache. It's very common that people's doctors will misdiagnose a migraine headache too. Why do they do that? For a variety of reasons. I think one of the reasons is because of simplicity. It's really easy just to, if somebody comes in and says, hey doc, I've got a migraine headache, for the doctor to just agree and say, well, let's start you on some migraine medication. Sometimes these medications will resolve a headache, or they will decrease the frequency of headaches. And so for some people that's good enough, and we could just move on from there. But other times it's not that simple, and so people can end up with complicated headaches. And there's sometimes when the medication actually makes the headaches worse instead of better. So first of all, let me start by telling you a story. The real tipping point for me in deciding to make this video was I recently had a high school student come in, and she had gotten sick a few months ago, and after that she started to get headaches. She didn't get headaches in the past, but after she recovered from this sickness, she started getting headaches, and she had a ton of stress trying to catch up with school that she had missed. And so on a daily basis, she was having headaches, and they were happening and at an increasing frequency and intensity. And so she saw a doctor, and they put her on medications, and nothing was helping. And so she had an appointment set up with a neurologist. That was pushed out several weeks. And so in the meantime, she came in, and it only took a few minutes of talking to her to determine, first of all, that this was not a migraine headache, and second of all, that there was a clear cause and a clear treatment, which is what I'll share with you at the end of the video. So first of all, before we move on, we have to talk about what is a migraine headache. So the migraine headache is a neurovascular headache. So what the heck does that mean? So neuro means nerves. So it has to do with overexcitement of nerves in your brain. And then vascular is blood vessels. So what happens is there is a profusion of blood that goes into the brain, and there's nerves in the brain, or neurons in the brain, that they get overexcited, and so they all kind of fire at once. And so it can cause a variety of things. One of the most common things is pain. It also will cause something called aura, which I'll explain in a second. It's kind of a chicken and an egg relationship, though. They don't know whether it's the extra blood flow to the brain that causes the neurons to become excited, or if it's the excitement of the neurons that cause extra blood flow to the brain. And the fact is, there's still a lot about migraine headaches that's just unknown. We don't always know why they happen. We don't always know why or how they cause pain. But that's an area where the knowledge base is expanding. In the meantime, fortunately, there's a lot of things that we could do to try and help them. one of the nice things about migraine headaches is that about 60 to 75% of the time, there are clear ways to make a diagnosis as to what is and is not a migraine headache. So here's a few features. Number one is when somebody has a migraine headache, typically it will just be on one side of their head. In fact, the word migraine that we use comes from a French word that it has Latin roots, which are hemicrania. Hemi means half, crania means head. So the idea is that a migraine headache typically will affect one half of your head. So already, if you're having really bad headache symptoms and you're feeling it like up here on both sides of your head or right here in your forehead, chances are that's not actually a migraine headache. Even though it may be very painful, it may be debilitating, more often than not, that's not a migraine headache. Now, there are some migraines that do occur on both sides. Most of them, though, are just on one side of the head. So that's the first thing. The other thing is this thing called aura, which I talked about before. So aura is something that somebody with a migraine headache might experience before the headache comes, or even sometimes during the headache. Sometimes what will be noticed is people will see like little spots in their vision, or like floaters or flashing lights, or things will kind of look like they're bending or distorting or twisting. There's some people that might get a weird taste in their mouth, or they will smell something weird. All these things are aura, and the thought is that these neurons that are firing in the brain that are overexcited, they're in parts of the brain that experience sensory input from our environment. And so when these things become overexcited, then we start experiencing things kind of in a weird, different way, and that's called aura. Another feature of a migraine headache is typically people will have sensitivity to light, sensitivity to sound. Sometimes people will have sensitivity to certain smells. It can be accompanied by nausea, extreme fatigue, and typically a migraine headache is one that's debilitating. You just want to pull the drapes, you want to get in a dark room and just be as still as you can until the problem goes away. One of the reasons that it's important to know what kind of headache you have instead of just throwing migraine medications at it is that migraine medications can sometimes make people's headaches worse. There's a few different types of drugs that are used to treat migraines. One of the goals of prescribing the medication is, first of all, to get the headache pain to go away. Another goal would be to prevent the headaches from happening in the future. So some people, when they experience aura, they take medication, they can circumvent a migraine headache. Now, the ones that are meant for pain relief would be like aspirin, naproxen, ibuprofen, Tylenol. Sometimes people are using those in combination. The big drawback to that is if you're getting headaches on a regular basis, like every day you're having headache, and so every day you're throwing an ibuprofen or Tylenol at it, then you can start to have a different kind of headache, which is actually a headache that you get from overuse of those drugs. And so while it may be giving you some temporary relief, it's actually kicking you into a cycle where you continue to have headaches. Now, migraine headaches are not caused because of an ibuprofen, naproxen, Tylenol, aspirin deficiency. And so it's not like you need to keep feeding your headaches these medications in order for them to go away. So really the answer is to find an alternative, something that's maybe closer to the root of what's causing your problem, to treat the headaches rather than trying to just treat the pain over and over and over. Other kinds of drugs that may be used are antipsychotics, antidepressants. A very popular class of drugs that are used to treat migraine headaches are called triptans. Like if you've ever used Imitrex, you've heard of Imitrex, which is sumatriptan is the generic name for that. All of these drugs have their own set of side effects. Like for example, triptans can cause nausea, they can cause fatigue, and other types of irritation like racing heart, things like that. And so in some cases, you're using these medications and you're trading one set of symptoms for another. And if you don't have a migraine headache, a lot of times like a triptan is not going to help you. And so you're still susceptible to the side effects of that drug, but you're not using it to treat a condition that you actually have. And so that's one of the reasons that it's really, really important to make sure that you have a proper diagnosis so that you can have a proper treatment. Otherwise, you're susceptible to all the side effects that come from an inappropriate treatment. So what is a good treatment for migraines? What's a good treatment for headaches in general? Well, the majority of headaches that people experience are actually tension headaches or cervicogenic headaches. So a tension headache is when you get tightness in the muscles in your neck or in your upper back, and it will refer pain into your head. And this can actually even be quite severe. It could be persistent. One of the other features of migraine headaches is that they will last anywhere from a couple of hours to a few days. Tension headaches can also be persistent. Just as long as the tension is there, you can keep having that headache. But tension headaches are typically the ones that are both sides of the head, maybe felt over the temples, maybe right here at the base of the neck, or even the top of the head. Sometimes tension headaches can also carry with it some nausea, fatigue, light sensitivity, and things like that too. Good treatments for tension headaches would be to help relieve the muscle tension. So a massage, spinal manipulation, stretching, those types of things, heat to those muscles would help to relieve some of that tension. Another important thing is to decrease your stress levels in your life, improve your posture, attack these things at the root that are causing your headaches to happen, and then the symptoms will go away too. Now, for the big thing that helps most people I found that have headaches of any kind, and this is migraine headaches, tension headaches, any other type, and I think it really should be the first plan of attack whenever somebody gets a headache. I think even before taking an ibuprofen or an Advil or something like that to cover up the pain, I think that the number one thing that people should do is they should try supplementing magnesium. So magnesium is a critical mineral in our body. It's so critical that if you went and you measured your magnesium levels right now, they're probably going to be pretty close to normal. The reason is because it's such a critical mineral that your body will steal it from other parts of your body in order to make sure that you have enough in your blood. In the case of magnesium, it's probably going to steal it from your gut. And so when people start getting deficient in magnesium, or I shouldn't say deficient, I should say insufficient. So when you're insufficient in magnesium, what you'll start to have is a variety of symptoms like gastrointestinal upset. So you might have some constipation because now your gut isn't working right. Headache symptoms are common. It's common for people to have difficulty with sleep, insomnia, difficulty staying asleep, things like that. Another common thing is for people to get muscle cramps. So if you're getting Charlie horses in the middle of the night, if you find that you're getting like a lot of knots and like painful trigger points, sometimes those knots are what's referring into your headache. Those types of things are signs that you might be short on magnesium. And so that is a good place to start, is supplementing magnesium. The one that I typically recommend to my patients, the form is magnesium glycinate. It's really good for replenishing a low supply of magnesium. I'm going to put a link to the brand that I recommend of magnesium in the comments. And so if you want to know my opinion on what's a good brand, you can follow that link and do that. So how much magnesium do you take? Well, magnesium is often found in laxatives. Okay, so milk of magnesia, the magnesia is magnesium. And so what I share with patients is what I call the toothpaste rule. So if you're taking magnesium and it makes your stool the consistency of toothpaste or softer, then you're probably there in terms of the amount that you're supplementing. If your symptoms haven't gone away and you're looking to supplement magnesium because you think that you might be deficient, then, or insufficient, there's that word again, then what you should do is take the magnesium until it softens your stool. If those symptoms are still there, try spacing out your dosage. So don't take it all at once. Usually I'll start people out at maybe like 200 milligrams per day, and then they might split that up into 100 milligrams in the morning, 100 in the evening. If that doesn't help, then what you should do is just scale back the amount that you're taking, and or maybe you have days when you take a little more, days when you take a little less, and so you kind of let your bowels be the guide on the amount of magnesium you're taking. But the bottom line is that supplementing magnesium is really, really effective for many types of headaches. And it's also really safe because remember, your body needs it and it has a way of kind of regulating and telling you when enough is enough. And so, taking magnesium and having a resolution of that is not a way to diagnose, oh, yes, this is a migraine, this was not a migraine, but it is a very effective treatment for that. Now, if you find that you're still having symptoms, the next thing that I'd recommend is to see somebody who can treat you for the tension that you're probably having. Chiropractic adjustments, massage, assisted stretches, active release technique, all these kinds of things are really good in terms of helping the muscles and joints that may be affecting your headache to relax, allow you to have proper blood flow to the brain, and so they could be really, really effective in getting quick relief from headache symptoms. So there it is, one of the most commonly misdiagnosed conditions that I see in my practice, migraine headache, which actually could be a variety of other types of headaches that if treated properly can resolve and you can get about your daily life. Again, if you want to try supplementing magnesium to help treat your headache symptoms, I'll have the link in the comments to the brand that I recommend. If you have any questions, also leave those in the comments. Hopefully this information has been helpful to you, and because headaches are just the worst. So they are a real headache. Anyway, I'm Dr. Jason Young, Body of Health Chiropractic and Wellness Center, and I hope you have a great day.